Can everyone see the screen?
Looks good.
Great. Hi. Hi, everyone. My name is Ethan Stancliffe. I'm a graduate student in Gary Patty's lab. And today I'm going to talk to you about a project we did predicting COVID-19 severity with untargeted metabolomics. So the motivation for this study came in the summer of 2020 when COVID was just starting to pick up, and it is still yet to leave. But at that time, we were starting to see cases rise across the world, and especially in metro areas, we started to see resources at hospitals start to get strained, especially in metro areas where ICU beds were filling up and therapeutics were becoming increasingly limited. And so we thought that since we knew that COVID-19 has a strong metabolic component, we hoped that if we could use untargeted metabolomics to find a prognostic biomarker that would allow us to predict early on in the disease course if someone would develop a severe illness or a mild case. And if we could do that, we could help hospitals better allocate resources and guide treatment options. So the data set we used for this study is a patient cohort recruited in St. Louis. It consisted of 340 patients where blood samples were taken longitudinally, starting near hospital admission and extending several months after enrollment. So in total, we had over 700 plasma samples that we analyzed with LC-MS-based metabolomics. We did both the lipid and polar fractions in positive and negative mode. And this data has been uploaded to the Metabolomics Workbench. But analysis of this data enabled us to identify 700 metabolites that we then profiled across all of our samples. And then what we did is we took the day zero samples, or the samples for these patients that were taken closest to hospital admission, and used that in a machine learning model that was trained to predict if someone would develop a severe disease later on or they would have non-severe disease. And so looking at these metabolic profiles a little bit more closely, in an unsupervised analysis in this PCA plot, we immediately saw that there is a signal that relates to the future disease severity in the day zero metabolic profiles. So that's what we can see here in this PCA plot, where you see grouping based on disease severity with COVID negative patients in green, the non-severe cases in orange, and the severe cases in red. And when we took these metabolic profiles and trained our machine learning model and then evaluated it on an independent test set, we saw that the performance was quite good. You can see on this ROC curve here, the performance on our test set is shown in blue, and that's outperforming a random model, which is shown in gray. But what's really important is that it's outperforming our baseline model, which is using BMI and age to predict severity. And that's kind of the current state of the field at the time. And so we were really excited about this predictive ability, but we also wanted to know what are the metabolic features that are metabolic shifts that are happening early on in the disease course that allow us to make this prediction. So we interpreted our model in more detail and found that although we profiled 700 metabolites in this study, there was only 21 that were really contributing to this prediction. And what was really striking is the majority of these 21 metabolites were all a particular class of lipid called a lysophosphatidylcholine, or an LPC. And what's really striking is that across all of these LPCs that we measured in our study, they were all significantly decreased in severe patients when compared to non-severe patients and those without infection. And so a nice aspect of our data set is that we not only have our day zero samples, but we can also look at how the abundance of these metabolites change over time. And so when we do that, we see that there are distinct trends, especially in these LPCs, where although they're already decreased at day zero, when patients go into the ICU and reach their peak disease severity, they are further decreased. And then later on, as they're discharged from the hospital, they recover. So this was really evidence for us that this is really related to the disease and not related to some other risk factor. And we also confirmed this in an animal model. So with that, I just want to thank everyone in the Patty Lab, especially my advisor, Gary Patty, and the co-authors in this paper, Miriam, Mickey, Donham, Kayla, and Leah, our funding. And then if you would like to learn more, this is the paper here. This is a lot more than I could present today. So thank you. I'm happy to take any questions.
Thank you, Ethan.